really, really very difficult, and I've run out of all my knowledge. I couldn't help her, so I said, well, why don't you give it a try? And a few weeks later, Dr. Lee, who is the patient's husband, sent me a message, said, we tried it and you'll be surprised how much better my wife was. And that was when, that was about a little over 5 years ago when I realized I wanted to introduce it to more people. And I started taking it myself, and then 2.5 months later, I experienced my first major health challenge, that I found that I have a big lump in my liver that needed to be removed. So it was about exactly 5 years ago that I went to Seattle and had that surgery. So the surgery was good and successful, I was told, but about 6 hours after I returned to the room, my blood pressure started coming down, like 70 over 50, and I stopped making urine, and I was having a lot of pain in the belly. So I called my wife, get the Renew 28, so I want to put in my abdomen to help the pain. So throughout the night, the resident doctor did the fluid and everything, could not bring the blood pressure up, and I still did not make urine. But I think she didn't think that was so serious because of maintaining so well. I was still thinking, I was talking, and in fact, the hospital forgot to change my status to being off, and so I was still on call. I still got some calls that got through in. But the long and short is the next morning they did the routine blood test and found out that I lost a lot of blood in the abdomen, and that was why I was low in blood pressure and the kidney was shut down. Now usually when that happens, the people's brains start getting foggy and dizzy, and also there's some lasting damage to the kidney. But I think even though I had that tube in my nose, I couldn't drink BSC, I was putting so much Renew in the abdomen that it got absorbed, and it helped my body to prevent some of the damages that happens when those things happen. So, so they went back in, found out that there was one vessel that they didn't clip out, so they didn't clip right, so they clipped that vessel, so I recovered. Now, and this picture was after the second surgery. I could barely draw in 500 cc in a breath. Normally, you should be able to draw in like 3.5 liters for someone of my age, my size. So when I got up, the oxygen level would come down, but I never got dizzy or anything. And so this was 2 weeks after I left the hospital, being the worship deacon in my church, and that was Easter Sunday. So I was leading worship, singing, and doing everything that the worship leader should do, and that just show you how quick the recovery was. And the kidney, usually when you shut down the kidney for that long, there's some lasting damage, but it has completely returned to normal. So that was later that year we went on a cruise, but even before that we went on a short-term mission trip to Taiwan with my whole family.
Give a big hand. And I want to thank him. As I travel through Asia, he creates a lot of content that all of our Asia ASEA family, you're rocking.